Welcome back to the Mind Gym, the channel where we exercise the brain, explore psychology, and build emotional strength every single day. If you're passionate about understanding the mind and want to learn how to manage thoughts and emotions with science-backed tools, make sure to hit that like button, subscribe to the Mind Gym, and turn on notifications so you don't miss our daily videos. Your support helps us grow a community dedicated to mental fitness, self-awareness, and resilience. Today, we're diving deep into a condition that affects millions of people worldwide, often in silence: hypochondria **, also known as health anxiety. This is more than just being cautious about your health. It's a consuming preoccupation with the idea that something is wrong with your body, even when medical evidence shows otherwise. Hypochondria can feel like a prison of the mind, where every sensation becomes a potential symptom, every ache a possible disease, and every headline about illness a personal threat. Let's begin by defining it clearly. Hypochondria, or illness anxiety disorder * is characterized by excessive worry about having or developing a serious medical condition. People with hypochondria may misinterpret normal bodily sensations like a headache, stomach discomfort, or fatigue as signs of something catastrophic. A flutter in the chest feels like a heart attack. A mild cough sparks fears of lung disease. An itch becomes skin cancer. Even after reassurance from doctors, the anxiety doesn't settle. In fact, it often intensifies. At its core, hypochondria is not about weakness or vanity. It's about the brain's relationship with uncertainty and threat. The mind is wired to detect danger, and in health anxiety, that system goes into overdrive. The body's normal signals are amplified, scanned, and catastrophized. Instead of trusting the body's natural fluctuations, the hypochondriac brain interprets them as evidence of impending illness. So why does this happen? Psychology offers several explanations. One is ** selective attention *. People with hypochondria are hyperfocused on internal sensations. They notice things most people would ignore, like small twitches, slight dizziness, or a minor rash. This constant monitoring increases the likelihood of finding something to worry about. Another factor is ** catastrophic interpretation *. A harmless symptom is instantly linked to the worst-case scenario. Instead of thinking, "I'm probably just tired," the thought becomes, "This must be cancer or a terminal disease." Cognitive behavioral models show that hypochondria is maintained through cycles of checking, reassurance seeking, and avoidance. For example, someone may repeatedly Google their symptoms, book multiple doctor visits, or ask friends and family for constant reassurance. The temporary relief these actions provide reinforces the behavior, but the anxiety always returns, sometimes stronger than before. On the avoidance side, people may stay away from hospitals, refuse to read health news, or avoid conversations about illness altogether. Yet even avoidance feeds the anxiety, because the underlying fear is never resolved. Hypochondria also often stems from personal history. People who grew up in environments where illness was a major theme, perhaps a parent was chronically ill or health problems were discussed often, may be more prone to health anxiety later in life. Trauma can also play a role, especially if someone has experienced a sudden health scare in the past. The brain learns to associate bodily sensations with danger, creating a heightened sensitivity to every signal. One of the most painful aspects of hypochondria is the endless loop of reassurance and doubt. You might go to the doctor, receive a clean bill of health, and feel relieved for a few hours or days, but then a new symptom appears or the old one lingers and the anxiety floods back. The mind starts whispering, "What if the doctor missed something? What if the test wasn't thorough enough? What if it's too late now?" This cycle can be exhausting, both for the person experiencing it and for loved ones who struggle to understand why reassurance never seems to work. Let's pause to highlight something important. Hypochondria is not about attention seeking. It's not about faking symptoms. The fear feels real, the anxiety feels overwhelming, and the distress is genuine. People with health anxiety are often deeply ashamed, afraid others will dismiss them as dramatic or irrational. This shame only deepens isolation and makes it harder to seek proper psychological support. So, how can hypochondria be managed? Psychology offers several evidence-based approaches. Cognitive behavioral therapy (CBT) is one of the most effective. It helps people recognize the distorted patterns of thinking that fuel health anxiety, such as catastrophizing and misinterpretation of bodily signals. Through CBT, individuals learn to challenge these thoughts and gradually reduce checking and reassurance behaviors. Exposure therapy is another important tool. Instead of avoiding feared situations, like reading about illnesses or going for routine checkups, people practice facing them without engaging in safety behaviors. Over time, the brain learns that the feared outcome does not occur and the anxiety decreases. Mindfulness and acceptance practices are also powerful. They teach people to notice bodily sensations without judgment, to observe anxious thoughts without buying into them, and to let uncertainty exist without desperately trying to resolve it. Instead of needing 100% certainty about health, which is impossible, they learn to live with uncertainty in a balanced way. Medication can also be part of treatment. Antidepressants and anti-anxiety medications are sometimes prescribed when hypochondria is severe or co-occurs with other conditions like depression. But medication is often most effective when combined with therapy rather than as a standalone solution. Practical coping strategies you can start using include limiting online searches, constant Googling of symptoms fuels health anxiety. Set boundaries for how often you look up medical information. Keeping a thought log, write down anxious health thoughts and review them later. Often, you'll notice patterns that show how repetitive and unrealistic they are. Delaying reassurance. Instead of immediately checking or asking for reassurance, delay it for a set amount of time. This teaches the brain that the urge to check will pass. Practicing grounding focus on your breath, your surroundings, or physical sensations like touching a textured object. This pulls you out of the spiral of anxious thinking. Building tolerance for uncertainty. Remind yourself that no one can ever have 100% certainty about their health. Learning to live with enough certainty is key. It's also helpful to involve supportive family or friends, but with clear boundaries. Instead of providing endless reassurance, loved ones can encourage healthy coping strategies, such as practicing mindfulness or engaging in enjoyable activities. Another important step is recognizing the role of stress. Stress doesn't just fuel anxiety, it creates real bodily sensations like tension, headaches, and fatigue. These sensations then become triggers for health fears, creating a vicious cycle. Stress management through exercise, relaxation techniques, and adequate sleep can reduce the fuel for hypochondria. The digital age has added new layers to health anxiety. Constant exposure to medical information, breaking news about pandemics, and online symptom checkers can make even the calmest person anxious. For someone with hypochondria, it can be overwhelming. Setting boundaries with technology is not about ignorance, it's about protecting your mental health. Curating what you consume, and when you consume it can make a big difference. It's worth repeating, health anxiety is common, and having it does not mean you're weak. It means your brain is trying, perhaps too hard, to protect you. The same vigilance that fuels hypochondria comes from the brain's survival instincts, but when those instincts become excessive, they cause more harm than help. The goal isn't to eliminate caution, but to bring it back into balance. If you live with hypochondria, remember this: recovery is possible. With the right tools, therapy, and support, you can break free from the cycle of checking, worrying, and doubting. You can learn to trust your body again, to live in the present rather than in imagined illnesses, and to reclaim peace of mind. The journey starts with awareness. By understanding what hypochondria is and what it isn't, you take away some of its power. By practicing new ways of relating to your thoughts and sensations, you begin to build resilience. And by reaching out for support, you discover that you don't have to face it alone. So the next time a thought pops into your mind, what if this headache is a brain tumor? What if this chest pain is something fatal? Pause, breathe, and remind yourself it's a thought, not a fact. It's anxiety speaking, not a hidden truth. You are more than your fears, and your worth is not measured by how healthy you feel in every moment. Thank you for spending this time with us here at the Mind Gym. If this deep dive into hypochondria helped you, don't forget to hit that like button, subscribe to the channel, and share this video with someone who might struggle with health anxiety. We post daily videos to keep you informed, supported, and equipped to train your mind for resilience. Stay strong, stay curious, and keep working out your mind at the Mind Gym.